what I would like to kind of show you, as you see on the screen, is this is your first email that you have got. I normally do this introduction thing because most of your questions and the most of your hiccups will be in the initial part. I just want to take time in kind of smoothing out those processes. It's just operational thing. It might be very rudimentary for some of you. Just bear with me for the next 5 minutes, and then we'll go into the next part of what I wanted to share with you, which is very I would say very important for new folks to get on with how we do this program. So this is the email that you have got today. I'm sure most of you, all of you should have got this email. And this email pretty much has the enrollment form. This gives us some information regarding you. We use this enrollment form when we talk to you, when the admins talk to you, when I talk to you, or any mentor talks to you later when you go into your resumes or anything with job placement assistance. This is the form we go to. So make sure that you complete this form. It takes like roughly a minute or two to fill out this form, and we use this form a lot. And then there's one terms and conditions document. This is just for our business ethics, business standard. You need to sign it that you have received the access to the portal. You have received access to Argus. It's kind of like validating what we said we are going to provide you. We have already provided. It is just something that we have to do, and we send out all this terms and conditions to ACCRE, which is our accreditation organization that accredits this program. So they kind of know that you are enrolling and you will be certified, and the certification that you get through Oracle Health Sciences and through MediPharm Solutions, they will know that you already started today. So 3 months from now, 4 months from now, whatever time that you take to get certified, they need to make sure that you did the course curriculum so that you got certified. So this terms and conditions and all those things also is important. And also from a business standpoint, we want to make sure that this document is signed from our end as well. So please do those two things. And the next things are your access to the LMS system, which will go into details. That is the username and the password. Each of you have your username and the password. And using this URL that is there, you kind of log in with your username and password, and I'll take you through the steps. I'll kind of screen share so it becomes easier. So you are going to use this learning management system, LMS, to access our material. All the things that you're going to need: documents, assessments, interview questions, success stories, anything that we speak will be here. So this is very vital for you to know how to navigate it. So I'm going to show it to you. And again, whatever I'm showing it to you is actually recorded. It is in a YouTube link. I'm just repeating it as we go along. So this is pretty much a repetition of what you already have here. So this is LMS access. Now, if you guys are in drug safety program, you will have Argus access as well, because Argus takes a long time to provide those credentials. We want you to get the whole show started. So we gave you Argus access. You don't have to log into Argus yet. You can wait until probably end of April to use it and kind of maneuver Argus and kind of go through Argus. But right now, you don't need to log into Argus. You just have to make sure you locate that email from Texol. Texol is our third-party vendor, Texol. You will get an email from support@texolcorp.com. They will send you the same username, the same kind of password with a URL for Argus access. So you just need to locate that email. You don't need to log in. You don't need to do anything, and you'll not be able to do anything because you'll not understand how to navigate it. So wait for further instructions on Argus login and how to navigate Argus. And whatever I'm showing you right now, it is in the LMS. I'll show it to you. It is on YouTube as well, how to access the recorded webinars. So the next part is the classes happen every Tuesdays and Thursdays, and normally they happen at 8 p.m. So just check your emails maybe before 5 p.m. on every Tuesdays and Thursdays. Before 5 p.m., before the office closes, the admin will send it out to you with the topic of the module, and you will have all the class reminders. Normally, we send it out at least one day prior if there is any cancellations or anything. But most of the times, you should make sure that you receive that email every Tuesdays and Thursdays. So get into the habit of checking the emails so it becomes easier. Your mode of communication, if you need anything from now, should be this email. This is our central email, students at medipharmsolutions.com. This is one email that you should send any questions you have until you get certified, until you go into job placement assistance side, everything until you're like done with MediPharm Solutions. That is the email. So these are all things that you need to know. I know that you might have read through this email, but it is very important for you guys to have the communication there. So how do you access the material? How do you access the modules? If you did not attend the class, how do you do it? So what I normally tell folks is just click on the link, the URL. The URL takes you to this certification program. So you can click on student login. It will take you here. Put in your username and password. And once you put in your username and password, everything that I'm saying is recorded. So you'll get the whole video in the LMS tomorrow. So once you log in, this is an admin account. You'll see all the programs, but for you guys, you'll see just one program, which is certificate program in advanced drug safety and pharmacovigilance. You click on this, and once you click on it, you will see all the modules from the first module, history of pharmacovigilance, all the way to the core. There are some self-learning modules, as you can see. It's called self-learning. Self-learning. These are not taught in classes, most of them. All core modules, like as you can see, adverse drug reactions, triage, workflow, seriousness assessment, all the assessments, medra, drug dictionary, narrative writing, E2B transmission, medication errors, which we are going to cover on Thursday. Dr. Mangala is going to teach you medication errors, and your classes will start from here. From Thursday, you're going to start medication errors, safety database, and then you go to Argus, and then you will understand how the flow goes. So you'll start with medication errors on Thursday with Mangala. I'll come back on Tuesday, and then I'll kind of go into safety database. So this is a sequence that you're going to follow here. And you go into Argus the first month of April, probably by 15th or 20th, you'll be done with Argus classes. So we'll teach you all Argus classes in April, and then you go back to your core modules, like from adverse drug reactions. So this is pretty much the flow of this whole LMS. So again, as you go towards the end of, these are all self-learning modules, and there are a lot of self-learning modules, as you can see. The difference between a core module and a self-learning module is core modules are interview-based modules. So if you want to do your interviews properly and you want to know the basic concepts of pharmacovigilance, then you need to make sure your core modules are solid. You know the knowledge, you know how to like communicate the knowledge to the interviewer. If you understand the core modules and the Argus, you will be able to understand self-learning modules. Self-learning modules are not 1 hour, 2 hour modules. They're pretty much like snippets, like 15 minutes, 20 minutes, kind of modules based on recent job descriptions. So if someone asks us a question in the interview preparation, and we think that, oh, this was not covered for our students, we kind of make it a self-learning module. So these are really like very small modules, 15-20 minutes, and sometimes we kind of repeat the modules in live classes, so it becomes easier for you to understand. But these are all self-learning modules. You don't need to really spend a lot of time right now, just to focus on your Argus classes and the core modules. That should suffice for now. These are success stories. Most of you might have seen these success stories on YouTube and LinkedIn, and you get the full versions here from everyone. I would recommend you to go through them as you kind of go through the course. Once you're done with all the live modules and all the self-learning modules and the core modules, this is what you take the final assessment. And in final assessment, you can take this exam n number of times. I believe you need to get 40 out of 50 right, and you can take a screenshot of your successful final assessment and send it to students at MediPharm Solutions, and they'll send you the certificate of completion with the credits. So that is how you complete the course. Once you're done with your certification, once you're done with your final assessment, then you can go into job placement assistance. There are a lot of videos here. If you click on it, you'll kind of see all the job placement assistance. There are a lot of videos here which are very self-explanatory. We kind of did this workshop. All of us chimed in. All the like instructors, Mangala, myself, Satya, Shalini, Anurupa, we all kind of did this course with the students. So everything that you see here is all based on job placement. So I would not recommend you to do this right now. Only when you certify, once you get certified, just do this thing. And once you are done with the whole thing, you're pretty much done with LMS. Now, the question that most of you will have is, how do I locate this video if I did not attend this class? So if you let us say you did not for some reason attend the upcoming Thursday class, the email will say the topic is medication error. So you locate medication error, you click on this link, medication error. There will be probably 1 or 2 videos. Just to review the bottom most video, this is the previous one. The video from Thursday probably will be the second video, or this will be replaced by one video. So if you review it, this is pretty much the content that you need to review. How do you kind of complete the steps towards the certification completion is, once you are done reviewing the video, if you have to do it, just go through the modules, do the assessment. Here is the assessment that you can do. Once you're done with it, you mark you should mark this module as complete. I think once you kind of go through it, it will say mark this module as complete. Like for example, if I click on the assessment, you can start the quiz, you can take the quiz, you can complete all the steps. And as you keep going, as you can see, 12 out of 70. So as you keep going towards it, out of 70, you pretty much go to your final assessment. As I said, you send the screenshot of your final assessment to students at MediPharm Solutions, you will receive the certification. And then after that, you will kind of go into job placement and all those things. Emails will come. There will be emails for your class calendar. For every month, you'll receive a class calendar. For April month, you're going to receive it after Thursday class. May month, you're going to receive it. So you can save that email so that you don't miss any classes. There might be little changes. Sometimes the class might be at 7 o'clock, sometimes at 8 o'clock. We try to like stick to 8 p.m. But just in case if there is any change in the schedule, that will be there on the calendar, so you can kind of block your time in the evening accordingly. And if you miss it, you kind of know that you have to go into these recordings and watch them. Once that live classes are done, you will get an email called end of live classes notification. Then you will not receive any Tuesday, Thursday classes. You can do your own self preparation, do the certification, do the job placement. When you come to the end of live classes, when the email comes out, you will not get all those things. And the last email you're going to get after the end of live classes is the job placement assistance. There's a bunch of documents that you're going to receive along with the videos that you see in the job placement. You will get, I believe, like 15 documents that will prep you for job placement assistance. How do you do your LinkedIn? What keywords you need to use? How do you search for jobs? Which portals you need to use? What kind of jobs you need to look for? How do you prep for the recruiter's call? How do you do your mock interview? All those things will come in documents. I know this is a lot of information for you. That's why it's recorded. Just go through it. If you missed anything, it will be tomorrow. It will be here. Course navigation. There will be one video. All these videos will be deleted. All these videos will be deleted, and there'll be one video, and this is the only video that will be there. And did I miss anything? So these are the emails, end of live classes, and then the last email you're going to get this job placement assistance. The duration of this, you will have access to all this material, all this content. Oh, I forgot to mention the textbook. You don't need to buy any textbook. The textbook is here at the end of it. I believe it's all the way somewhere near the job. After the job placement assistance, it should be somewhere here. I'm not looking at it. It should be below that. That would be a textbook. You don't need that read the text. You don't need to read the textbook cover to cover. It is just a reference guide, just to kind of skim through any kind of words that you are not finding. And that's a PDF format. We will also send you the PDF format, and all the slides for core modules will also be sent. So you don't need to take screenshots, and you don't need to do all goofy things. Everything that we teach you, we are going to share it with you. So it's nothing private. Everything we're going to share it with you, so that you can kind of be rest assured that everything is being handled. I mean, given to you and handled properly. Once you are toward the end of job placement, you will have access to it for 6 months from now, like literally from April 1st to pretty much April, May, June, July, August, September, maybe October. So until November 1st, you have access to all this material. And of course, the slides and everything, we'll send it as PDF, so you'll have it forever. And some of you may have an objective to do this course in lesser time, and some of you may need more time. Whatever pace it is, just work with me, work with MediPharm, and we'll figure out a plan for you so that you can do it faster or you can do it slow. It depends on your objective. I would recommend you at least to give yourself 2 to 3 months. I don't want you to rush through it. It's a lot of content to go through. You don't want to go to your first interview and say that, oh geez, I need to kind of review the material again. You don't want to do that. It's a very easy thing. I believe that you guys have done a lot of education so far, that you should not really make this complex. It's a very simple subject. It is simple to understand. If you keep it simple, it will yield the results that you want. So don't just complicate it by just running through it and crushing through it. This is not something you're going to do it over the weekend. So just to pace yourself. And this is how you mark complete. I could not find it before. So this is how you kind of hit the mark complete. So you complete your steps. So everything I just narrated to you will be here tomorrow in course navigation or introduction. It will be the first thing, and you will see one video here. Questions? Any questions on this?
Sorry, sir. I have a question, sir.
Sure.
Yes, sir. My name was not spelled correctly when it was sent. Is it going to affect the certification at the end of the program? That's the one that has to do with the main
No, it
AC.
doesn't. No, it doesn't. It is just for communication.
All right.
Yeah.
All right.
Yeah.
Thank you.
All right, guys, if there's no questions, I would like to welcome everyone again, and we'll do student introductions probably next week sometime. We'll just take the last 15 minutes of the class. You're going to see a lot of folks on Thursday, because one batch is one cohort that started in January or February, I believe, is going to end with this module, and you guys are starting with this module. So don't think that on Thursday when you come in, there's only 8 people. You might see 20 people, but that doesn't affect you because you're anyway online and you're remote. So it's not you're like sitting in a class. But I just want you to give a heads up. You will see probably 20, 30 people along with you in the class, because one batch, I think 2 batches will be leaving and you guys are starting. Is that making sense? Yes, no?
Yes, sir.
Yes.
People on video, yes, no?
Yes.
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 Andre, you're silent. Your silence is scaring me.
Yes, everything's fine.
Yes, everything's okay.
Okay, any questions? Please email students at MediPharm Solutions. I'm just thinking if there's anything that I need to tell you. So is it clear how to access the modules right now? How you can go into medication errors and all those things? Yes?
That's clear.
Yes,
Okay.
sir.
So I have just one recommendation. This is out of my interest on your success, and I don't want to give you a lot of do's and do nots. with the experience of mentoring students in PV, I just have one thing I want to tell you. As much as possible, guys, please attend the live classes. Don't depend on recordings. Don't depend on, oh, I'm going to do everything over the weekend. That may happen sometimes. Life happens, I understand, but as much as possible just be in the class, because the sessions that we have, the discussions that we have, are very instrumental, very key for your interviews, because not everything is subject. Sometimes we give some examples, we talk, we answer questions, we do all those things. Even though everything is recorded and you have it in the recorded version, nothing beats the essence of being in a live class. That's the only recommendation I have, and that will really set the whole platform right for you. And along with that, uh, do take some time initially. Don't try to force the subject. Let those synapses form very organically. You don't need to understand the whole class initially. If you understand 20% of the class, that's more than enough. As you kind of keep going through the classes, I'm sure it is very simple. We teach in a very simple and ridiculously easy way. And everyone does the same job. All instructors have a blueprint of what we teach and how to teach, but give yourself time. Don't try to rush through it. All right, that's all I had. What do you say goodbye in Haiti, Linda? You
It's
speak
almost the
French or
same thing.
Creole?
Yeah, Creole, French.
Yeah,
It's almost the same thing. Bye bye.
no, Baba is too simple.
Yeah, okay. Male.
Malay, yes, Malay. Obina, what do you say bye bye in your language?
In Africa, it's Dalo,
Palu.
Igbo language, yeah, Dalo, Igbo language, yeah.
What, Saida, what do you say in, you're from Bangladesh, what do you say in Bangla?
Allah Hafiz.
Allah Hafiz. Malika, Telugulo ఏమంటారు?
వెళ్ళొస్తాం.
వెళ్ళొస్తాం. దృష్టి, గుజరాతీలో ఏమంటారు? What do you say in Gujarati?
Avjo.
Amcho. Okay. So this is all recorded. If you want to learn languages along the way, it's free. It's covered in the tuition that you're paying. There are 6 languages to learn. All right, guys. I'll see you guys on Mangala will see you guys on Thursday, same 8 o'clock. But I'll see you on Tuesday for safety database. Okay.
Okay.
Thank you, sir.
Thank you so
Thank
much.
you.
Thank you, sir.
Bye bye.
Bye-bye.
Thank you.